Hello, everybody. Little bit of technical difficulty. Sorry, we're a couple of minutes late. I'm Lisa Palladino, and I am here with Dr. Jennifer Falcone, who's my chiropractor friend and team member for Team Tongue Tie in Staten Island, New York. A little bit about me, if you don't know me, I am Lisa Palladino. I'm a certified nurse midwife and a lactation consultant in Staten Island, New York. I teach and support all things about teamwork for diagnosis, assessment, treatment, and rehabilitation of tongue tie and other oral restrictions. So without further ado, I'd like to introduce Jennifer Falcone, Dr. Jennifer Falcone, who's a chiropractor here on Staten Island. Dr. Falcone, would you like to tell us a little bit about yourself?
Sure. Hi, Lisa.
Hello.
Thank you for having me.
Oh, it's my pleasure. I'm so glad to finally have you on.
Finally, we get to jive.
Yeah, we're like the original, the basis of the team that we have here, right? We've been friends for so long and treating babies together for so long. It's great.
Yes, it's been a while. So I'm Dr. Jennifer Falcone of Falcone Family Chiropractic and Wellness here on Staten Island. And I've been treating babies since 2005. A little bit about me. I did extensive training in school for pediatrics and obstetric chiropractic and landed my first job after I graduated in Borough Park in Brooklyn. So if anyone is familiar with the area, they know women there have a lot of babies.
Sure too. I did some midwifing in Borough Park, I know.
So basically treating babies just fell on my lap, and we've done very well. So I continue to do my studies. And as soon as I opened my practice in Staten Island in 2010, I met Lisa at a baby symposium.
Yes.
Right?
Wow. Remember that day? It was funny because I was already working as a midwife, and my patients were telling me that they were coming to you during their pregnancy. So then I started referring other patients to you, but I never met you. You know, we had so many mutual patients, and then we were finally at the same place at the same time, and we met. The rest is history. No. Yeah. And then I became your patient, and I can vouch for the care that you've given me and my whole family, and so many babies. So, the subject here is tongue tie. And tongue tie as related to breastfeeding, but not just about breastfeeding. So, I have my own definitions of how the oral structure works, but I'm only, that's not my specialty. So if you want to talk a little bit about what tongue tie means to you and how you see it affect babies, that would be really helpful.
Okay. So tongue tie, for those of you that don't know what it is, and everybody hears about it, and it's so common. Well, tongue tie, the special term or the technical term is Ankyloglossia, okay? And basically what that is, underneath your tongue, there's a piece of skin that attaches to the mouth. Babies with tongue tie, usually that frenulum or that skin that connects the tongue to the mouth is short, thick, and tight. Now, without getting too boring in genetics, one of the reasons why babies have a tongue tie is due to the MTHFR gene mutation. And basically what that is the child's inability to methylate folate, okay? And therefore they have neural tube defects, or basically midline defects. And a lot of that starts from the spine, and it shows up as scoliosis or cleft palate, and also something simple like a tongue tie. So besides, we're also recommending for mothers now, instead of taking folic acid like they've been recommended by their OBs, we recommend eat more spinach like Popeye, or take a methylated folate supplement.
Right.
So basically, what do chiropractors do? I know that's a question everybody asks, especially for an infant, right? Yeah. I'm sure everyone saw YouTube videos. Or Seinfeld, right? When the big guy jumps on their patient, they hear all these cracking noises. But what we do is first we assess everyone, okay? Do I believe everybody needs chiropractic at some point in their life? Yes. And why is that? is because the spine is made up of 24 movable bones.
Mm-hmm.
And a lot of it is just these little bones going out of alignment or biomechanical stress to the spine, even during childbirth.
Mm-hmm.
Right? Children are really forcefully ripped out of moms. If you've ever watched, you know that the doctor turns their head forcefully and rapidly to ensure the baby comes out fast. And although it saves the baby's life, you know, God bless, a lot of our infantile mortality is reduced because of this. It does put a lot of strain on the head and neck of the newborns.
Yeah. And so, and you know, just speaking as a midwife, even in natural birth where there is no intervention, babies do have to make a lot of twists and turns and awkward moves to get out. And sometimes it's a tight fit. Sometimes they've been cramped in an unusual position, right? And then the interventions such as hands-on or, you know, vacuum extraction is very popular now.
And just vaginal contractions, right? And uterine contractions as the baby comes out.
Right. And a fast birth is, you know, we think, oh, that's great, it's a fast birth, but sometimes the babies look like they're in shock, right? Because of they get to make those adjustments and take their time with it. I don't know if you've noticed a difference in babies whose moms have said, oh,
we
that's
need
such a
some
fast
squeezing. We need some of that squeezing love.
Yeah, exactly.
That's a different topic altogether. But as far as biomechanical stress and injuries during childbirth, that also affects how a baby latches.
Of course.
It contribute to difficulties breastfeeding and with a tongue tie.
Mm-hmm.
So what we'll do is assess the spine, see if there is any of these biomechanical injuries or joints that aren't moving well, and we call them subluxations. And then we adjust them. Now, a baby adjustment is extremely gentle. So usually you don't hear the cracking noise, which, by the way, nothing cracks. It's actually just an air bubble popping when a joint moves through its full range of motion. So basically, a child adjustment, we just apply a gentle force. And if I were to press on a tomato, it wouldn't even break the skin. So that's how gentle it is.
Right.
And we address also intraorally the TMJ. So some of these biomechanical stresses affect the cranium and the skull. The TMJ.
I was going to say, let's back up. TMJ. Let's explain what TMJ is, because not everybody may know that term.
Okay, so TMJ is your temporomandibular joint, basically your jaw.
Right.
And that controls sucking and biting. And Lisa could probably explain this better than me. Children that do have a tongue tie, because they're not able to open fully and their tongue's not able to project past the lower gum line, they tend to chew on mom.
Right.
And that kind of sucks the milk out as opposed to sucking.
Right. Yeah. Like what I like to explain is if a baby, if the tongue, like say this is the jaw, if the tongue is really close to the bottom, when the baby has to open wide and then lift its tongue with its mouth open. So if they go to lift the tongue and the tongue is tied, the mouth is going to close and they're going to have a shallow latch or pop on and off, get lots of air while they're feeding. That's the reflux, right? A lot of sit up, a lot of colic from having, you know, gas in the belly. So a baby needs to be able to open wide. And sometimes the baby may look like they have a tongue tie, but it's something else going on, right? I mean, it could be anything.
Right. It could be
preventing the baby from opening wide.
Correct. It could be subluxations of the upper cervical spine or like the top of your neck. And most people don't realize that the spine actually starts right below your head. So this right under your ear is actually the first bone in your spine, in your neck. That's where the spine starts, and it ends all the way down at the tailbone. And speaking of digestion, colic, a lot of times too, babies are born, well, usually babies in utero are in the fetal or the curled up position.
Right.
Right? So then when they come out, their lower back and their neck naturally goes in the opposite direction, right? You get the C shape as opposed to the fetal shape. the base of the spine, that's where all your parasympathetic nerves are. And basically, if parasympathetic is responsible for rest and digest.
Right.
So part of the adjustments, we always check full spine, but if there is colic, reflux, constipation, a lot of times babies with the tongue tie have different color stools, mucus stools. So we'll look to the sacrum or the tailbone to calm down the parasympathetic nervous system and aid in the digestion.
Right. That's so interesting. So a lot of people wouldn't think about the nerves actually at the level of the spinal cord being responsible for what's going on in the internal organs, but that's how it works. Everything comes through the spinal cord, right?
Absolutely. Your brain is the computer. Right? And how it sends the messages is down the spinal cord, which lives inside your spinal column.
Right, right. I'm just going to interrupt for 1 second. I just noticed, and if you see me distracted, everybody, I'm taking my time to check for messages and stuff. We have lots of people tuning in to watch us, and I just want to say thank you. And anybody who's here live, please feel free, you know, to put in some questions or comments and let us know you're here. And, you know, we want to be sure, we could talk all night, but we want to make sure that we hit the topics that you're interested in. So any questions for Dr. Falcone at all, whether it, you know, anything to do with baby or chiropractic, you know, please.
And please ask me the scary questions. Some people are afraid to get their children adjusted, or some people think, you know, like I said earlier, it's forceful, it'll hurt. One big question that I get asked a lot, excuse me, I'm having like a little sinus thing today.
It's okay. You could take a sip of water.
I am, and I have my Star Wars cup. Very, very child friendly. But most people's misconception is that once they get adjusted, right? So an adjustment is what we do to the spine when you come to a chiropractor. So just simple terms, subluxation. Like I said, that's the biomechanical stress to the spine. That's when the spine's not moving properly or it's kind of stuck out of alignment. And we call that a subluxation when it puts abnormal stress then on the nervous system. Like I just said, the spine runs down, the spinal cord runs down the spine.
Right.
So any interruption in the spinal bones is going to interrupt the nervous system function. And how we correct it is with an adjustment. An adjustment is anything from, yes, the loud cracking noises that you hear, or just applying that gentle pressure to the vertebra. And like I said, for an infant, it wouldn't even rip the skin of a very ripe tomato.
Right.
Okay? So these adjustments calm the nervous system and enhance it to express itself fully, because these nerves are controlling every organ and organ system in the body.
Yeah. So I can vouch for, you know, it's no secret, I'm your patient, right? And sometimes I'll come into your office and you'll give me an adjustment and we'll be talking and I don't even feel anything. And I'll come out and say, I don't know what she did to me, but I feel better. You know, so it's very subtle, and it doesn't have to be a violent action for there to be a difference. Because honestly, I get so many parents that, like, when I say bring your baby to the chiropractor, I get some funny looks from some people. And they're, you know, some people have never been to a chiropractor themselves, or have and have had not a great experience, or have had an experience of thinking about, you know, maybe their neck was cracked a little bit or whatever, and now they're thinking of that for their baby. So I'm really glad that you're explaining that that's not the case. And one of the things that I always say to my parents is, you know, I know for a fact that your waiting room is full of babies and repeat babies. You know, so people come back a second, a third, you know, whatever, lots of times. So if you were hurting their babies or doing something really scary, people wouldn't be bringing their kids back and bringing their kids back for years, right? You take care of full families, which is
whole family. So that's why it's Falcone Family Chiropractic.
Right.
We do treat
And Russ is in the background. He's going to be posting your stuff onto the feed. If anybody's interested, if anybody's local, you can check out Dr. Falcone's website and her office.
Wonderful. Thank you, Russ.
And yeah, Russ is always helping out.
Yes.
So the other,
I just want to finish what I was saying about the second question that most parents have or people have, is that once you go to the chiropractor, you always have to go to the chiropractor.
Right.
And does my baby, if they start at birth, will they need it for the rest of their life? The answer is simple. Just how you brush your teeth in the morning and you have to again at night, or if you can't eat one huge meal and never eat again.
Right.
So once we do an adjustment to the spine and it's corrected, so to speak, you don't have to continue to adjust that part of the spine over and over again. Mm-hmm. It's just that now when you do have something come up, you go to the chiropractor instead of popping Advil or putting Bengay or going for a massage.
So it's like tune-ups, sort of.
Well, tune-ups, we call it more wellness. So we do recommend everybody at least get a checkup to see if you have a subluxation once a month, once every other month, because life happens. Right? So we don't live in a vacuum. We're moving. We wake up stiff. And with children, there's some key points where they really should get checked for subluxation. And if the obvious is after birth. The second is when they start to hold their head up. You know, the head is the heaviest part of your body. And that's why forward head posture and text neck is becoming such an epidemic. Because it puts tons of stress on the neck and the spine and the nervous system.
And getting back to that, you know, the head is the biggest part of the body. It's even more disproportionate as a baby, right? The head is so much of the size of the baby. You know,
it's faster than any other part of the body.
Do you want to talk a little bit about, I don't want to interrupt you, but I don't want to forget to talk about head shape and plagiocephaly and torticollis and all those fun things that can affect infants and young babies.
So plagiocephaly, for those that don't know, is when a cone head, or when a baby's head is flat on one side, or a flat head, or they're kind of missing a lot of hair right behind the back of their skull. And infants, right, we all heard of the soft spot. You know, don't touch the baby on her soft spot. And because their brain is growing, we have sutures, which are kind of spaces in between the cranial bones. And, you know, babies a lot, because they're in those infant car seats, you know, or even baby wearing, or, you know, back to sleep, right? That's the big thing now. Babies are constantly on their backs with their head pressed, and that misshapes the head. The good thing is their bones aren't fused yet. So there are people heard of craniosacral therapy. I personally don't do a full craniosacral, but I have taken advanced studies in cranial adjusting. And believe it or not, it's tiny, tiny little movements that help reshape the head. Okay, so if you think your baby has plagiocephaly or a flat head or a cone head, before you put them in a helmet and restrict their motion, which will lead to further subluxations because their spine's not moving, you should get them checked, and we could help them with that as well.
You know what's frightening to me sometimes? Like, I'll see a baby and their head shape looks off to me, and I've seen all types of shaped heads, you know, flat, sometimes a little, you know, asymmetrical, where the ears aren't even because of the flattening and things like that. And I'll say, well, did the pediatrician say anything? And the answer will be, well, he's not ready for a helmet yet, meaning there's nothing that's going to be done until they need extreme intervention. And I know that chiropractic, you know, and craniosacral, and there's many things that we can do to make it so it never gets that bad, you know. And, you know, I just, it bothers me when I hear that. Like, why would you wait until something's really wrong? But I really, I think that a lot of pediatricians don't realize, at least in our area. I don't want to put down all pediatricians. I just want to say it's not.
Starting to. I feel like Staten Island is finally catching up with the times.
Yeah, we're
one of my biggest referrals is from a pediatrician.
Right. But there's a lot of pediatricians.
But there is a lot that.
Yeah.
And the proof is in the pudding. So when the babies come, and I encourage them, some are scared to tell their pediatricians. And I said, no, especially if the baby, obviously if they're doing better, make sure you tell them. And tell the ENTs, right? So when your child has an ear infection, ear, nose, and throat, chiropractic helps with that as well. I mean, I don't want to get too off the tongue tie, but tongue tie relates to flat head, cleft palate, jaw dysfunction, right? Not being able to open and close, reflux. Right. So a lot of these tie together, and a lot of these we just help as a group when we do the adjustments to the spine.
And that has to do with the musculature of the tongue and what it's attached to, right? I mean, the tongue isn't independent of everything around it. And that's why all the other things happen. I mean, that's my understanding.
Right. So basically what controls your tongue is your nerves. So we want to ensure that the nerve going to the tongue has no dysfunction. And a lot of people too, we should talk about maybe the frenotomy, because if there is an attachment and the baby does need a revision, that needs to be done because they can be adjusted constantly, but the stress of trying to stick the tongue out, it's kind of like a circle, a hamster wheel. If you don't correct one thing, it's going to keep going circles. Because the tongue attaching to the mouth, then attaching to the jaw, attaching to the spine is going to lead to this dysfunction that needs to be addressed from all areas. So like that are truly attached need the frenotomy, and we have a guy who does laser. Laser is actually the preferred treatment because it goes deeper. And I've seen babies when they would go to just a pediatric dentist where they would use a scissor. But scissor is only for an anterior or the front of the tongue, full attachment.
Right.
A posterior, you can't really cut it because it would cause too much bleeding.
Right.
So the laser kind of gets it far back enough where there's more range of motion with the tongue.
Yeah, we've discussed that quite a few times on Tongue Tie Experts. We had a whole IBCLC panel, and Dr. Siegel was here one day, and we did an interview with him. But what I like to do, and I believe that this is our best work together, is if a baby has a tongue tie. Some babies have a everyone has a frenum. Everybody has one. But the position or the tightness can matter. So if somebody just examines and sees a frenum, but the baby's doing fine, it might not be the frenum that's causing the problem, right? So it's a full assessment. It's not just looking, right? That's why it's important for a lactation consultant.
Absolutely.
But even in the case of if I see a baby that looks so tied and tongue tie, lip tie, now I see buccal ties in here, a lot of tightness in the
Explain
whole.
What that is, buccal ties.
Buccal is the attachment right inside the cheek. Could be on either side. Sometimes I tend to see it more on the right than the left, which I don't know why, and I don't know if other providers are seeing that too. It's not always it's not always even. It's not always symmetrical where the restriction is. But if a baby is able to feed at all, I like for them to have an adjustment before they go for the procedure. Because what I find is babies who have seen you especially do better with the procedure. Because if everything is all tight, if a baby can't move his neck, it doesn't matter if we free that tongue.
Right.
He can't move he still can't open and latch, right? So I call it football shoulders. Like there must be a term for it. But I see babies that are like this. So how are they going to feed, right? It has nothing to do with the frenum. So what's the technical term for football shoulders?
Well, it could be anything. It could be,
you know what I mean, though.
Cervical subluxation would be
those kids that are so tight like that.
Spasms, rounded shoulders. part of the birth too, when they turn the head and the shoulder, if the shoulders don't come out right, you kind of get like an Erb's palsy where the traction, right, your C5 nerve from your neck. So there's different reasons for why the baby does have the football shoulders, and that's why it's important to come, to me or any chiropractor for an assessment to see where the spine's misaligned, the nerve is pinched, the nerve going to the muscle is causing that hypertonicity or spasm or tightness or elevation.
Right. Yeah. So the baby, even if we did the procedure, then if the baby can't open his mouth to latch without being able to move his head and neck, then we're not going to see an improvement.
Correct.
So that's why I usually send them to you first. And then I always say to my parents, let Dr. Falcone tell you if she thinks, because I think it needs to be done, but let Dr. Falcone, because sometimes you may say, oh, the tension isn't under the tongue. The tension is somewhere else. Right? Or if there's some work to do before you go. And
well, one of the reasons they should get checked and adjusted before the procedure is, one, if they are so tight, it'll be pretty hard for the doctor performing the frenotomy to get in the mouth.
Right.
It's like anyone before surgery, if you're tense, if your muscles are in spasm, if you're unable to move. I recently had an older patient with gallstones. And they were severe. She went to the emergency room, and she had to lay like this to get them to do the sonogram, but they didn't realize, well, here you have an older woman with scoliosis, degeneration, hernia. She barely was able to get in the position for them to do the ultrasound. And then by the time she got up, her husband literally had to carry her into the office.
Aww.
So on a lower level, it is the same with the babies. You need to get them ready, kind of like a pre-op prep, so that they're calm. You want their nervous systems calm. What adjustments do, basically it calms your nervous system. It takes the stress and the ease, and that will calm the baby. And therefore, there's not such that emotional stress before and after the procedure. Because nonetheless, it is a procedure when they do get the frenotomy.
Yeah, and it's an adjustment.
That's all, and it's an adjustment.
Yeah, they have to adjust to their new way of moving their mouth and the new way of being. But luckily, babies bounce, right? Babies
very resilient. We always say, good thing they don't remember. It's like getting your ears pierced when you're young enough. You don't even remember.
So the procedure, one of the things, and I think you hit on it a little bit, is one of the other myths I hear about chiropractic is, well, how long will I have to go for? Like as if you want to keep people in your office longer than they need to be. And I don't mean you, I mean just chiropractors in general. And one of the things that I tell my patients is sometimes I'll see a baby and say, this baby needs Dr. Falcone. And they'll say, oh no, she told us we don't have to come again for a month. But now things have changed. So I'll say, no, you go back. So you're not keeping babies around longer than they.
No, absolutely not. And that's why a lot of people will call. First off, most patients, unless they're in severe pain and I just want to comfort them, I don't do an adjustment on the first visit.
Right.
The first visit is a full, and people that have come to the office know there's a paperwork to fill out, a book. So you fill out a thorough paperwork. We do a thorough exam. Unlike some chiropractors, sadly, that I know. And, we check the baby completely. And I will that night do my homework and go over the entire case, and then will I come up with a treatment plan. And obviously, every single baby is different. So, and as the baby comes for adjustments, it's just like people. Everyone's different, right? You have people that love massage and love to be touched. And then you have people that hate to be touched.
Right.
So that's just the personality thing. And depending on what type of child it is, well, then that depends on how long they'll be in the office, how successful each adjustment will go, and how long it'll take for them to get better. But like you said, a baby, might be released from my care You know, they're holding their adjustments from one visit to the next. Motion is restored, nerve function's restored, they're feeding well. And then they go in the car seat and they're like this for 5 hours on their way to grandma's house upstate. And then they see you because, wow, baby's not feeding well again.
Right.
And you say, oh, well, go see Dr. Falcone.
Right.
And that's where the misconception might, fall.
Yeah, for sure. And those car seats, baby in a bucket, as I call it.
Right.
So just as a public service announcement, car seats are for the car.
Yes.
Leave the car seat in the car and pick up the baby.
Pick them up and or leave them on the floor. There's so many boppy seats, bumbo seats, swings, especially with back to sleep.
Right.
Children need to be on their tummies and they need to be on the floor. Right.
So let's talk a little bit about that. What does tummy time do for a baby as far as development of the nerves and the spine? I mean, I know from my ideas what it is, but I'd love to hear you, if I'm telling people the right thing, because I know that to develop, we need to be on our bellies, right?
Absolutely. Children need to be on their bellies. And one of the reasons, back to sleep, because they're always on their backs.
Right.
Prior to, I don't know, what is it, the 90s that they started?
Right. Yeah.
Babies actually slept on their stomach.
Mm-hmm.
And during this time of the back to sleep, children aren't crawling on all fours anymore. Mm. If you notice, they're scooching or the military crawl, and a lot of it is because they don't have strong necks.
Wow.
So when a baby is on tummy time, they're forced to hold their head up, right? Nobody wants to face plant. And it gets them to hold themselves, and it strengthens their upper body, their neck, their spinal muscles. And that and proprioception. So basically, what is proprioception? It's your awareness of where you are in space. Mm-hmm. So the more your neck is responsible for that, the nerves that come out of your neck.
That's so interesting.
Yes. Mm-hmm. So the more you're able to know where you are in space due to proper head control and strength, mm-hmm. I don't know what I'm trying to say.
Yeah, no, that's another reason why we need the development.
You need to develop strong head and neck for proprioception, proper nerve control, head control. And now, because everyone's on the computer and on their texts, you need a good base and strong foundation so that when you're old enough to go on the iPad, sadly that's at 3 years old.
When you're 6 months?
You want to be a little strong, right.
So, tummy time can be done from birth, right?
Yes.
I mean, there's so many myths going out there and going on around that I hear. You can't put the baby on their belly till the cord falls off. I don't know where that one came from.
I didn't even hear that one yet.
Yeah. There's a group on Staten Island that's preaching that. And she didn't give me the okay for tummy time yet, talking about the pediatrician. I have a theory, and there might be some science behind this, that the reflux epidemic that we're seeing now has to do with back to sleep and no tummy time. Because doesn't the maturation of the GI tract in the front mirror the muscle in the back? Like, doesn't that make sense? Like,
I think it's more about balance. So if a baby's always on their back, they're not using the same muscles and the nerve pathways as they are when they're on their stomach. Mm-hmm. And they also need to be on their sides too, side to side. As far as reflux goes, I think it's more detrimental when they're propped up.
Okay.
Because what happens is when you're propped up, you're actually shortening the esophagus and closing down on the stomach.
So that's the car seat position again.
The car seat position, or there's like these wedge things that they put. I mean, very rare is there a child with a true reflux. And my first question to all the babies that come in, are they projectile? Mm-hmm. Are they even spitting up?
Right.
But there's this new silent reflux that pops up. Right. Because the baby is colic or they hear a little rasping. Well, there's different variables. Is the baby overfeeding? They're always on their back, so they're not on their stomach and going in different positions to enhance digestion. All right, and being flat on your back, especially after you first eat, right? Most babies, they eat and they fall asleep, right?
Right.
So then you put them on their backs for back to sleep. And that's compressing the lower back sometimes, especially for a newborn, because they just came out in that fetal position and their low back is starting to go in an opposite position. And that does put stress on, like I said earlier, that parasympathetic nervous system. And if there's stress there, well, then digestion's not happening 100%.
Right. So yeah, I have a couple of comments coming in on Facebook, and we have Sarah that said skin to skin right after birth. Well, skin to skin is the ultimate tummy time. Of course, that's the natural way to be right after birth. Thanks, Sarah.
Right, we don't mean tummy time, throw the 1-year-old on the floor.
Right.
We mean, even if you have them lay on you. Right. I think for me, it's more important that they're in all positions. Skin to skin, absolutely. I mean, right when they come out, they should go right on mom.
Yeah, and changing position, and I preach supervised tummy time for naps. So what I tell parents that come to my office is,
I say that I'm like, between you and I.
Yeah. Between you and I and the internet. I'm not afraid to say this. And you know what? The Academy of Breastfeeding Medicine, I believe it was. Don't quote me on that. Somebody just came out with a statement saying that you should be in a safe position when you fall asleep with your baby, because people fall asleep with their babies. So the tide is turning to realistic education for parents. And one of the things,
I think stomach sleeping is a better position than a propped up sleeping when the child has reflux.
Yeah. So what I like to say is, if the parents are in the room up and about and watching, and say the living room with the bassinet or kitchen with the bassinet, wherever your situation is, then it's safe, flat surface, no fluffy pillows or blankets around the baby. Baby can sleep on their belly. The fear is so strong with this back to sleep campaign that people think that if they put their babies on their belly for a minute, something bad is going to happen. And that's just not true.
No, I agree.
We all slept on our bellies.
We all slept on our bellies.
And I'm not going against the back to sleep campaign. I'm just saying be judicious about it and give equal tummy time. And I love what you said about side lying. I used to do that with my own kids, flip them, now you sleep on your left, now you sleep on your right, to make sure that they got all positions. And that stimulates the sensory system too from different positions, right?
Right, correct. So just as we were saying how the spine, and it's so crucial that the messages going from the brain go, it's just as important for that feedback loop of what's coming in. All that sensory information coming in is then fed to the brain so that the brain can respond properly.
Right. Okay, let me just see this. Okay.
And that's basically what chiropractic does.
In a nutshell.
Chiropractor basically ensures that the brain is speaking to the body and the body is speaking to the brain 100% without interruption.
Right.
And that's one of the ways to be healthy.
So somebody, let me just see this question. Rose today had sent me a question, and she wanted to know how soon after, I'm not sure if we went to this, how soon after the procedure for release of the tongue tie do you like to see babies?
I would say a day after. I actually had a newborn today that just had the procedure. Ideally, from a physiological, biomechanical standpoint, right after the procedure. But from an emotional standpoint, I would say the next day.
Yeah, that probably means emotional for the parents too.
Absolutely, right. More so probably for the parents.
Yeah.
But the baby, it's painful. And I know Lisa has some homeopathic or herbal remedies for that. So definitely consult her, because you see the babies right after, usually before Lisa sees them, and they are in distress.
Yeah, it's uncomfortable.
It's uncomfortable.
Yeah.
And then that makes mom apprehensive to do the stretches, which are crucial you know, because it is an open cut, and what cuts do and what a healthy body should do is heal.
Right.
And if it heals too fast, then we're not stretching inside, which I do also for the babies that come to me afterwards. You know, you do have to really stretch the tongue and all the intraoral muscles to ensure that the release does what its job is to do, and that's for proper tongue movement and jaw opening and closing.
Do you also do release like internal into the mouth? You release the tension, right? Like pressure points and things like that, or?
Yes, I do intraoral on tongue-tie babies, even chronic sinus infections, ear infections, anything that involves the cranium, the jaw, you know, things that like I said, sinuses and allergies and ear infections, we do intraoral adjustments for that.
Yeah.
And it moves those tiny little cranial bones, and it releases the tight musculature inside the mouth.
Right. You know, it's an aside to talk about ear infections, but I know so many families whose kids are having chronic ear infections and use chiropractic and come to your office, and it, you know, the kids lose the they don't need to be on antibiotics like they used to be, because you're treating them and releasing it and getting things moving. And
but don't wait until you get the tube scare.
Right.
We have a lot of those, you know, and I think there's one ENT who won't give me recognition, but he says, yeah, it works sometimes. You can go to her.
So yeah, no, I hear it working a lot.
And I think the AMA or the Pediatric Association, they no longer recommend antibiotics for infections anymore.
Right, especially not the first or second rounds, right? Okay, so a baby will come back a couple of days, the day after, and then
the day after.
So then about, in general, I know every baby's unique, but just to give people an idea, in general, about how long will a baby be under your care? Couple of months.
Treatment plan would probably be twice a week for 4 weeks.
Mm-hmm.
At that time, I'll do a reevaluation.
Mm-hmm.
And then we could see some babies need some weekly adjustments afterwards. And some I really, you know, I want to check them again in 2 weeks just to follow up and see how the mom is doing, how they're feeding, you know, any life things that have happened from the last visit. And so I would say the first month I'll see a baby a lot afterwards. It could be anywhere from 1 to 3 times a week.
Okay.
For the first month, and then after the re-exam. Once I release a baby from care, I do recommend the world, womb to tomb, you know, at least, like I said, once a month, once every other month, get checked for a subluxation.
Yeah, I agree.
I want my nervous system working 100% all the time, and I think, you know,
I think the babies deserve that.
Babies deserve that, absolutely. So I also think the misconception, oh, well, well, you know, when they were born, we checked everything.
Right.
No, they really didn't.
Right.
Whoever checks your nervous system?
Right.
Nobody.
Even
when you go for a physical, maybe they'll check your reflexes, but reflexes don't tell you anything of how a nervous system is functioning.
Right. Right. So in you know, total aside, but things like, how would you know, other than pain, how would you, as an adult, what would be signs that your nervous system isn't quite right? Would it be like twitchy things or restricted movements? Or
movements, tight muscles, anxiety.
I think headaches too, right?
Headaches. A feeling like you just don't feel right. You feel sluggish. You feel foggy. A lot of people feel foggy. For children too, you know, pediatricians don't even know how to check for scoliosis. So many of my children accidentally, you know, I'm the one diagnosing them with the scoliosis. Digestive dysfunction.
You found one of my girls and she was way older, that it should have been discovered younger. So yeah, absolutely.
Yep.
And not mild either. Totally missed. you know?
Yeah.
All right, we keep bashing pediatricians. That's not fair.
No, listen, they're great at what they do and what they're trained to do. What they're trained to do is treat illness.
Right.
They're not preventing and promoting wellness. That's just not, people ask me that all the time too. If I have a recommendation for a holistic or a like-minded or, an all-natural, open-minded doctor. And I tell them it has nothing to do with them being open-minded. It's what they're trained to do. Medical doctors are trained to diagnose illness and pretty much write a prescription for it.
Right.
They're not taught vitamins. They're not even taught really how to read x-rays.
They're not taught nutrition.
They're not taught nutrition.
They're not taught breastfeeding.
Right. I mean, there's a lot of things, but yet, if you have some rare, crazy disease or you have diabetes where you need insulin, I would go to my medical doctor. I would.
God forbid in an accident or, but wellness, no. Wellness.
Right. They just don't know about it. So it's not that they, but the problem is some of them snub.
Yeah.
And that's not nice.
Right.
Just because you aren't aware, or aren't trained in a specific area doesn't mean you should bash someone that does know.
Right. And we should all work together because, we should be.
Because it's about, helping. We all took a Hippocratic oath and the goal is to do no harm and to help patients.
Right.
And that's what we're kind of all here to do.
So let's bring it back around to the team, right? So, I have a feeling because usually when I do these Facebook Lives, we have a lot of professionals watching. And I feel blessed to have the team that I have. I refer to you, Dr. Jackie Hines, who's been on, and Dr. Scottsiegel. And, we're very lucky. And that's not the case everywhere. So if there was an IBCLC or even a pediatric dentist or someone who's doing tongue-tie releases and they wanted to find a chiropractor that was, how would they find a chiropractor that, is there a specific certification in pediatrics or is it just, how would we find somebody to be?
The highest specialized training of a chiropractor to treat pediatric would be a diplomate.
Okay.
Not really too many people even know what that is.
Okay.
But my suggestion would go to the ICPA website, the International Chiropractic Pediatric Association, which I'm a member of as well. If you go on their website and you put in your zip code, local chiropractors that are involved in special trains in pediatrics will show up on that website. And that's pretty much the gold standard. That's like the AMA of the pediatric chiropractic associations.
Yeah, and I also think, of course, word of mouth.
Definitely
that's how,
word of mouth, and definitely, you would want someone that does this also contributes to the better cause and research, so that you don't have parents and doctors, thinking it's so bizarre that an infant would go to a chiropractor. And the only way to kind of get rid of that stigma is research.
Right.
Research and ways to contribute to that are to join these professional organizations.
Right. Like the professional organization ICAP, which is the, I'm going to blow the name. It's a long name, but it's for all different disciplines related to Ankyloglossia. So ICAP is a great organization, and I believe that we're trying to at least consolidate the research, and there's lots of members that are starting to do research to prove what we already know, because we've seen this, and the way we have a team here, there's teams in cities all over the world who are seeing the results we're seeing, and we just have to prove it. We have to prove it.
And the only way to prove it is to do research.
Right.
I'm a little negligent myself. I hate paperwork. Everyone who knows me knows I love to be on my feet.
Right.
Hands-on, running around the office, but part of the job is the paperwork.
Right. So the other thing is that it's important. The communication is important. The way people are watching us banter about this, we built this up over years, right? And we learned together. If I learned something, I came to you and told you. Same with me. And we
sending each other notes or
right
screenshotting from seminars.
Right, and talking to each other about different kids. And how many times have I been in your office to watch you
Very
adjust the
important
baby?
to have friends. You know, some
Right.
people want to amass everything for themselves.
Mm-hmm.
But yeah, no, I don't see that. I see
Yeah.
amongst us a lot of camaraderie.
Yeah, but I think it's important, like, you know, don't be afraid to reach out. You know, if you're listening and, you know, you're a professional who doesn't have a team, don't be afraid to reach out, because chances are there's someone else in your neighborhood who is doing the work that you want to pair up with them and talk about it and learn to work together. Because I know that my practice has been enriched by having your experience, and I would hope vice versa. We've learned from each other, right?
Lisa, I text you sometimes with questions mid-patient.
Right.
You know, I'll run out of the room and just.
Right. And then, you know, who benefits from all of this? It's our patients. It's the families we serve. You know, we lift each other up, we learn together, and we do better for our patients. And
I love what you just said, serve. You know, one of my affirmations that I say every morning, you know, is thank you, God, for giving me the ability and the power to serve.
Yes, it's all a mission.
It's all about service.
Yep, absolutely. Let me just make sure that I'm not missing any questions. Excuse me. Oh, somebody's asking, Sarah's asking about, oh, hi, Melissa. Melissa's listening. What do you think about the latest bash on tongue tie in the Atlantic, I believe? I don't even want to address that, because I don't know if you saw that. It was a horrible article about this procedure that's being done unnecessarily, and they even quoted doctors who were saying the right thing, and they quoted them out of context, and it looks bad. So we just have to keep talking, Sarah. Keep talking the good talk, getting the truth out there.
There's good and bad. I mean, there's bad in every profession. I'll share a personal story of when I was probably 12 years old, and I went to the dentist with a cavity. And the dentist, you know, buzzed away, drilled my tooth, filled it with amalgam and mercury, right? But back then, that was good for you. You know, it was durable. It lasted forever. If you see, it's still in there. You know, but, you know, filling a 12-year-old with mercury in her mouth, and then when the Novocaine wore off, I'm playing with it with my tongue, and I literally cut my tongue.
Wow.
Because the dentist just drilled, filled, and didn't file.
Wow.
Needless to say, it was a terrible experience.
Right.
And I went back to the dentist, and he actually was annoyed. Wow. Why are you back here? I said, why am I back here? And I took his finger and I showed him. And then he, you know, he filed it down. Point of the story is, do I bash dentists? Am I never going to the dentist again? You know? No. So there's good and bad. There's going to always be that person that doesn't understand. And sometimes ignorance and negative is what really draws and attracts the media. Mm-hmm. And people like attention.
Right.
You know? So we're all about promoting positive and healthy attention.
Absolutely. Absolutely. So I think that we're going to wrap up now. This was so much fun.
It was. I hope you know, we gave some good information.
Yeah.
And again, ICPA for those not in the area that need a chiropractor.
I believe that Melissa might have posted that for us.
Okay, awesome. I love my Melissa.
Yeah.
And Lisa, it's always a pleasure.
Yeah.
Thank you so much. You know, for even when I first came to Staten Island and befriending me and just kind of feeling that connection right away, that we knew we were here to help people together. So
yes, it's wonderful.
And I miss having you across the hall. But
I know. So yeah, for those who don't know, we used to be in the same building. We used to like get to hang out together a lot. But now we're both in different places. We're both in bigger and more beautiful offices.
Yeah.
But
all right, everyone. If you have any questions, feel free, email, check out our website.
Yes, absolutely.
We'll give
just before I sign off, for those who don't know, I'm supposed to advertise my stuff. I have a book. I believe Russ put the link in. It's here. It Shouldn't Hurt to Nurse Your Baby. And my model for this is about to have her second baby, so maybe we'll have a new cover soon. It's available on Amazon. And for parents, I have the tongue tie, Parent's Guide to Tots. It's all about tongue tie, preparing for the procedure, getting through the first night, what it's like, the exercises that need to be done, why pain relief is important, why Bodywork is important. It's all in there. So that's for parents. And for any professionals that are interested, I have an affiliate link so that they can share with their patients. So if you're a dentist or an IBCLC and you don't want to put together the teaching materials for your own practice, you can actually use mine, get the link and use that. And it's very,
Awesome.
there's videos and there's handouts, and people are finding it very, very helpful. So again, thank you so much, Dr. Falcone.
Thank you, Lisa.
All right. Have a good night, everybody.